Hello, welcome to MChart. This video has been designed as a user guide to help you make the most of MChart. MChart is a tool designed for planners and managers to help them navigate the Canberra mental health system to support better decision making. Let's have a look at the homepage. At the MChart homepage, you can find a rich source of information relating to the mental health care system in the local area. This version of MChart focuses on Canberra. If you click Browse Services at the top of the homepage, you can immediately search for a mental health service near you. Click Features again at the top of the screen and you can explore the individual layers of information that make up MChart. By clicking on Resources, you can find publications and other background information relevant to the development of MChart and get further information you might need. For example, after clicking on Resources, scroll down and you will find all of the dictionary of terms used in MChart. You can also find some helpful FAQs. Click on About and you can learn more about the team that has built MChart. The main area of interest for health planners can be found by clicking on Advanced Dashboards, again at the top of the home page. Users need to log in to access this data. You can request access to MChart by using the Request Access button at the top right of the home screen. The Advanced Dashboards bring together 8 layers of information which together form a clear picture of the mental health system currently operating in Canberra. You can combine these layers to bring deep insights into mental health in the local area by suburb. I'll take you now through each of MChart's 8 layers and show you how they work and what you can explore using MChart's example in Canberra. The MChart Services dashboard is where you can find all the information about mental health service providers located and operating across the ACT. You can explore the providers and services on the map in the centre of the screen. You can move the map around and zoom in and out to assist with your search. When you click on a service, a pop-up shows their name and address. Providers are listed in a table at the bottom of the screen with information about contact details, opening hours, target group and eligibility. The search buttons are at the top left of this screen. They allow you to search by provider name, by suburb or service descriptor such as psychosocial service provider. Let's do that now. We've used a set of standard descriptors for the services to enhance consistency and make MChart easier to use. On the right-hand side of the screen are several filters which summarise characteristics of the providers found. Here you can list things like how many providers are providing services of a particular type, for example, outpatient, inpatient or day service. Let's select the day services. You can choose how many are working with specific age groups or with particular cohorts of clients, for example, veterans. You could also list which providers are public, private or non-government run. The services layer is designed to give users a feel for the overall geographic spread and location of mental health providers and services across Canberra. MChart's Workforce Dashboard provides a picture of who is providing mental health care in the ACT, what types of professionals, where they're working and who with. The left-hand side of the dashboard allows you to search by practitioner, suburb or service type. Let's search for all the services in Belconnen. The filters on the right-hand side allow you to select by profession. Let's search for all the psychiatrists. The map in the middle presents the results, which are also listed at the bottom of this screen with contact and other details. You can also see the results summarised by the type of service, by the target group they are working with, and also by age. MChart's Mental Health and Environment dashboard shows different population and healthcare indicators such as age or citizenship status, together with indicators such as diagnosis or service setting like inpatient or outpatient. On the left-hand side of the map are demographic indicators like age, citizenship status, as well as neighbourhood characteristics like alcohol licences and crime rates. These are shown by the height of the bars for each suburb. For example, here are all the people born overseas by suburb. On the right-hand side of the map, healthcare indicators such as mental health disorders, prevalence, and places of care are shown. Results are shown by colour on the map, with the darker the colour, the more significant or prevalent the indicator. For example, here are all the people who were treated for personality disorder. Services for the suburb selected are shown in the map and in the table at the bottom. This dashboard gives a sharper and more detailed picture of who is using which services and where. The inpatient utilisation dashboard shows service use across all public inpatient mental health services in Canberra. The map shows you the location of services. You can search across all services or restrict your search to specific services. You can see the number of patients for 1 year or dating back to 2016-17. Here are all the inpatients for 2019 and 20. You can also see the average length of stay, the principal diagnosis recorded at admission, and the legal status of patients. Here are all the involuntary admissions by year, condition, and length of stay. Services with their contact details and other relevant information are listed in the table at the bottom of the page. The outpatient utilisation dashboard shows service use across all public outpatient mental health services in Canberra. A map in the middle of the screen shows you the location of the services. You can search across all services or restrict your search to specific services or locations. You can see the number of patients by year dating back to 2016-17. Here are all the outpatient services for 2020-2021. You can also see the mean number of visits per patient for each year. You can also see the average and median length of service use and the principal diagnosis recorded. For example, here are all the outpatient services for people with anxiety in 2020-2021. You can also see their average length of service and their number of visits. Services and their contact and other details are listed in the table at the bottom of the page. The Emergency Utilisation Dashboard shows service use across public emergency mental health services in Canberra. The map shows you the location of these services. Services and relevant information such as their contact details are listed in the table at the bottom of the page. You can see the number of patients for years dating back to 2016-17. Here is 2019-20. You can also see the average and median length of time spent by patients in ED in minutes, as well as the number of patients by reason for their visit to ED, their diagnostic category. For example, here are all the patients who came to ED due to depression in 2019-2020. The bar graph on the right shows the average length of stay. Click the toggle to switch to the median length of stay. This dashboard also shows the number of suicide and self-harm for each year, as well as the number of readmissions to ED. One of the most important elements in a mental health care service is the extent to which it is accessible by public transport. This dashboard transposes the MChart's mental health service map with known existing regional transport links to provide this picture. MChart doesn't just list mental health services in the ACT and how to find them. Using the Reported Service Connections dashboard, planners are able to see a more complete picture of how Canberra's mental health system operates. MChart presents connections data from 3 years, 2020, 2023 and 2025. Each of these pictures shows the strength of the relationships between all the services working in the ACT. We show this strength in two ways. If an organisation has many strong relationships with others, it will appear as a bigger player on the connections map. We also list the number of strong relationships reported by that organisation as a number on each circle that appears in the connections map. You can zoom in and out to improve your view of the system, or focus on just one area or organisation. You can compare the shape of each connections map across the 3 years available in MChart. Using these connections, MChart offers a picture not just of Canberra's mental health services, but of our system as a whole.